As a healthcare provider, how do you improve your patient outcomes? Well, you need to start by measuring your patient experience across your facilities and staff. In this example, I'm going to walk through the steps for designing a simple patient experience dashboard. The data is coming from patient surveys that are issued by the provider, and we'll follow the initial steps of the enterprise dashboard process right up to the creation of wireframes. This particular case study is going to be a pilot, and it is focused on one of the hospitals owned by the healthcare provider, which owns many. This is going to be somewhat of an easy pilot to do because the data that they have is entirely based on survey information. So the major effort here was crafting the questions that go into the survey. However, there are still major problems and some of the reasons feeding into why they needed to do this. So they don't know where to focus their improvement efforts, hence the need for doing some surveys. Where are they going to put their money into improving the patient experience? There is currently no bridge between patient and employee experiences. How does employee behavior impact the patient experience? And ultimately, there's no single view of patient feedback. A number of surveys and research has been done in the past, but none of them are being consolidated. The idea here is to prove the pilot in one hospital, first measure the patient experience, and then come up with the actions that are needed to improve patient experience and ultimately patient outcomes. So the objective, improve patient experience and patient outcomes by understanding their current experience through our facilities, staff, and providers. So it's the whole patient journey through this particular provider's hospital. As always, we're going to be stepping through the enterprise dashboard process. In this case, we're going to be going right up to the wireframing. At the end of this case study, you're going to be seeing 4 wireframes that were produced as the basis for how they want to move forward and build the actual dashboard ultimately. We design for a specific persona. In this case, it's Buck Rogers, a fictitious name. I always use a fictitious name, but in this case, it's not hard to spot because it's the COO for one of the hospitals. Some of the key characteristics, obviously very experienced in operations, big operations background, also has an incentive, has several KPIs given by the company for this COO to improve patient outcomes. So he's actually really incentivized to actually do this. So this is a large part of the reason why it's happening. Always like to get a quote. In this case, I don't know where the major pain points are for patients in my hospital, right? So has an idea, has some anecdotal information, but really wants to get down to what's actually happening and not rely on anecdotes. Big advocate for data, just hasn't had the ability or time to deal with it because always doing firefighting. Some of the goals, standardize across the hospital network. So this pilot works, it's going to get rolled out amongst a bunch of other hospitals. And ultimately, they want to improve patient outcomes and increase employee retention. Some of the challenges, little to no data sources for sentiment, but that's okay in this example. The singular data source are going to be these surveys. Not going to use any other data that's been gathered anywhere else. That's going to be for down the road. For this pilot, it is more than adequate to use the survey data that's going to be deployed. Some of the other things are typical metrics, the net promoter score. And these are things that are definitely going to be sought after in this dashboard. Patient rating, overall patient outcomes. If we can't measure that before, how are we going to measure it after? And then patient tenure is something that they look at quite often. Before we dive into the wireframes, I want to do a quick recap on the storytelling basics and how the wireframing works. We follow the basic storytelling narrative arc. Once upon a time, there was a persona. We're always designed for a persona. In this case, it's the COO. One day stuff happened. So think of this as the KPIs. You're going to see them up at the top of the dashboard. So one of them goes orange and one of them goes red and tells us something happened. And because of that, there was some impact and perhaps some other impact. And we're going to be looking to the charts on the dashboard to tell us what those impacts are. But ultimately, we want those charts to facilitate an action and ultimately a resolution. How that manifests in a layout, we're going to have navigation level, and that's really going to be introducing the persona. the navigation tabs on the dashboard are really focused on the persona, so they're going to intuitively understand what those tabs mean. Your navigation may not be at the top, it may be at the bottom, maybe elsewhere. It depends on your dashboard technology. In this example, we're showing it at the top, and you can look over to the right to see how this gets more built out in the dashboard layout. The story highlight, do I need to act? Remember, those are the KPIs at the top. Story resolution, what action should I take? You usually have the layout of 4 charts, and then we have the filters over to the left. Taking that a little bit further, how do we facilitate a path to action? And on the example over to the right, you can see we've got a KPI, it's gone orange, and on the bottom right, you can see we've been very deliberate in how we do the design here. We know that this means there's an action to call supplier and ask, why are we short in inventory for 3 product lines? And so just a general example of how you would use a chart to facilitate some sort of action. And ideally, the next time you open this dashboard, those things are resolved and you're no longer seeing the orange for this particular occurrence. Whenever we're starting any kind of dashboard, it's really good to define who the personas are that are involved in this and who are the people. In this case, it was very small group. We had the business stakeholder. This is basically the COO. And then we had the consultant, myself, and then a BI developer. Very, very small group, largely because we're dealing with uncomplex data. And there's no need for building a model, so no data scientists needed. IT is not needed because it's a pilot in this case. It's going to be small. A lot more people are going to be involved should the pilot be successful. And obviously the BI developer is the person who's going to be doing the actual heavy lifting and doing the dashboard work itself. So here we go. Here is the wireframe, the overview tab for this particular user. So imagine you are the COO. There's some really high level things you need to know. And look along the top here. Look at these KPIs. So we've got a hospital rating. Okay, it's 7.8. Imagine your threshold is 7.5. You've been given a KPI, maintain your hospital rating above 7.5. Now in this case, 7.8, we don't need to worry about it. That's why it's black. It's not changed color. However, the provider rating, the providers within our hospital are below our threshold of, imagine it's 7.0, and that's why that 6.7 is orange. So that's already flagging the COO saying, look, we've got a problem. This is something we need to focus on. The patient outcomes are largely positive, so we're looking good, and also the patient experience is pretty good. Now we get down to the nuts and bolts of it here. You can see each of the charts are having the title that's in the form of a question. So the very first one, is there a relationship between hospital and provider ratings and patient outcomes? Look at the second one. What aspects are patients most dissatisfied about? So this is very much feeding on the survey data that went into this dashboard. Down the bottom left, which providers are patients happiest with? And the bottom right, what do patients say can be improved? And this one's a bit interesting because it is free text that patients have been allowed to write into the survey. So how do we capture that information? Well, one of the quick ways of doing that is a word cloud. It's not going to be the most accurate in the world. However, it is going to say, here are the words that are getting repeated the most and whether they are positive and negative. Positive or negative in this case. It's just very, very generic right now. So the idea with the wireframe is not be overly specific. We don't need to be. We need to say, look, this is the chart type that's going to be used. And what's most important is the questions that are going up there on the top. Now also to the left, we can see the filters that were important for the COO, the patient age range, the patient tenure, and also the provider name. By selecting any of those filters on the left, it's going to update all the KPIs and the charts on the right. So moving on to the patient sentiment tab, this is really getting down to the core of what the survey is all about. So look at the KPIs along the top. Patients with positive outcomes, patients with negative outcomes, doctor-nurse rating, facility rating, all really important stuff, right? So, and these are definitely very distinctly different things that were pulled out of the survey. So facility rating, that you're going to see some of the questions you're going to see around that, but that would be things like, were the bathrooms clean, or did the beds get changed on time? These kind of questions related to facilities, and it's very important to have that sort of holistic view of it. Some of the questions here on the charts. What aspects are patients most dissatisfied about? What aspects are patients most satisfied about? What would patients like to see improved? And what were patients' favorite aspects of care? Again, those last two are free text. Slightly different filters here on the left. So the age range was the same, but we've got patient gender and also a repeat from the last one, which is patient tenure. Moving on to the next set of wireframes. Up the top, provider rating. So this one's okay, but it's orange because it needs to be better than that. The average tenure with provider in years, 1.9, retention rate, and average number of visits. So some of the key questions here that we're asking, remember this is the provider focus, right? So the tab is really looking just at what patients are saying about the providers. What aspects are patients most dissatisfied about? What aspects are patients most satisfied about? Retention rate by age. What are patient outcomes by behavior? So this is a lot of effort went into defining what these questions are and how we're then going to display those and roll them up into a dashboard. And again, we've got very similar filters on the left, but this time we can filter by provider name on the top left. So moving on to the employee sentiment. Now remember, it's all data based on the surveys, but also surveys of patients, but also a survey of employees. So it's a blend, okay? So it's going to be the patient experience of the employees, but the actual employee experience as well. Right up the top on the KPIs, the employee engagement score, their response rate, so only 54% responded, satisfaction, and NPS score. What is employee engagement by department? That's the first chart we have. Next one, what is employee engagement month on month? We can see that it's improving over time in this example. What is employee engagement by tenure? And then what are employees saying in their surveys? And again, this is free text. The filters on the left, we can look at employees by department, by their employment tenure, and also by their level. So that brings us to the end of the wireframe, and you can see the overall idea that the wireframe will give you is what questions we're trying to answer, and are these valuable to the persona that it's designed for, in this case the COO. Thank you for getting this far, and I hope you got some valuable information from this case study. We do have several more available on our website, and should you wish to engage our services, just reach out at logic2020.com. Thank you.